For countless Nigerians, the struggle for survival has gone far beyond just finding food or shelter. Increasingly, it includes the struggle to access even the most basic healthcare. As the economy worsens, more Nigerians are unable to get the treatment they desperately need. For many people, this lack of access is not just an inconvenience, it can be a matter of life and death. Finding healthcare in Nigeria involves locating a hospital facility nearby, being able to afford the services that they render, and ensuring we receive the proper treatment when we arrive. In many communities, patients have to travel long distances, and by the time they get to the hospitals, the treatment they need may not even be available, or the hospitals can be overcrowded, making it hard or impossible to receive treatment at the end of the day. We've heard different stories of different Nigerians, some of which will be featuring in this video, of how lack of healthcare system, of lack of healthcare has affected most of them, leading to several severe health challenges on them and even their loved ones.
My name is Helen, Teaching Manager of Ignition, Wadata. I'm here to talk about community health, how hospital that is very far away from us, how it has made a great impact and it has felt the health of the people around the community. Like for instance, the main road, that lead to the main road is very, very bad. When we are in serious condition like this, the farness of the hospital from us has caused a great effect on the people and everybody around. For instance, one of my neighbors got born with hot oil. Before we were able to even get a bike that would take him, it became something very serious. Then I had to seek for the intervention of the ministry, which they actually came, they intervened, assist us to take him to hospital. Getting to the hospital, the nurse were neglecting the issue. The doctor was not giving quick attention to it. We had no choice than to take him to a different chemist close by, where we can give him first aid treatment first and foremost. Sincerely, if we have an hospital within the community or inside the community, it will be of great help. It will reduce the causes, losses, and the damage that will happen to a lot of patients and people around us.
My name is Zainab, and I'm a mother of 4 children. I'd like to talk to you about one of the challenges we're going through in Nigeria as a country, and this is not having good access to health care. Take, for example, one of my children was sick, and I had to travel a very long distance to access a good health care. But upon reaching there, they couldn't admit my child because they claimed there was no space for us and there was no place else, so I had to take him back home. And of course, I'm not a medical personnel, so I didn't know what to do. The child became so sick, it developed into paralysis. Today, this child can't walk well because one part of his body is paralyzed. And thank God, because Ignition Nigeria is bringing a good healthcare to us. And I'm sure other mothers will be so happy at this new development because Ignition Nigerian is going to be bringing to us good healthcare where we can access health care for our children and for us. Thank you, Ignition Nigerian. Bye.
At the internally displaced persons camp, the government has set up a healthcare facility. Unfortunately, what was supposed to bring relief have turned into a source of frustration for the residents, as essential medications are often unavailable, leaving patients without proper treatment. Some residents shared heartbreaking testimonies, revealing that the only medicine doctors constantly administer is Panadol, regardless of the ailment. For people already facing so many hardships, the lack of adequate care feels like yet another burden they must carry.
My name is Arthur Peter. My problem is for the head side. You know, say as we get people here plenty, person must sick. But the hospital we always there here with them. The medicine it's not insufficient. The medicine is not enough. If a woman or a man and go hospital now, they will not give them enough medicine. You can receive a Panadol, and that Panadol cannot help you a lot. So for the head side, that is our challenge. The medicine no dey enough. Now only a Panadol, because the Panadol will help you for the head pain, headache. It cannot help you for a stomach pain. So we are asking about the head. If there's any this if there's any a helping hand that it will help the hospital and we will get the more medicine, it will help us more. We get one woman where she get belly, and it was in the night. During the night time, the belly come to pain the woman. Now before the day go break, we no know how the thing come do and the belly come spoil, and the pikin die. And the woman also, they can't carry us, they can't carry the woman go teaching hospital, they can't give them blood. Now from there, now the woman can't survive, but the pikin don't die. It's because of the hospital. It's not working as it will work.
Let us also consider the painful high cost of treatment and medicines in Nigeria. For the IDPs who are already struggling just to survive, paying for healthcare is almost impossible. Many are forced to choose between buying food for the day to survive or getting medicine that they need to cure whatever sickness that they are having at that particular moment. This is a choice which no one should have to make.
The government brought a hospital here for us. We go there for treatment. Sometimes there will be no drugs. They will give us paracetamol for treatment and the nurses there or the doctors there, they will prescribe drugs for you to go and buy outside. Which the IDP, where do they get money to go and buy drugs outside? Because we don't have money. Here we stay, we are just like in the cell here. No place for you to go and look for something. In short, that is the challenges again. We are here, maybe if there's drug, that wouldn't have been problem. But there's no enough drugs. Sometimes enough drugs. If you go there, sometimes they will give you anti-malaria drugs. When you take the anti-malaria drugs, if it is fever, sometimes you recover. Sometimes due to lack of much drugs, you will not recover as well. You'll be managing yourself.
My name is Blessing. I dey for DP camp, mega camp. I stay here for long, but I no dey well. Yesterday I go hospital. Doctor do any test wey they do for me, all the tests wey they do, they can't write medicine for me. Just say me I go buy. They give me 4 Panadol, but me I don't have my money. They say me I go buy medicine before me I dey come back. Even my leg, I get belle. Even antenatal I no get medicine wey they give for me. I carry my money go buy medicine. If I no get money, where they managing my life with my children. And the money where they managing and eat, they can't carry and go buy medicine.
The consequences of this broken system are deadly. Too many Nigerians lose their lives from treatable illnesses or injuries simply because care is too far, too expensive, or unavailable. Emergencies like childbirth complications, accidents, malaria, or infection can quickly turn critical when the system fails to respond in time. A few years ago, a couple who moved to Nigeria in obedience to God's call welcomed their child in a Nigerian hospital. They are here with us today to share their experience and the circumstances that surrounded the delivery.
Esther's birth was quite the whirlwind. when I was pregnant with Esther, I had malaria 5 times, and I had typhoid 4 times. So it was quite challenging. When I went into labor with Esther, I had malaria, and Gabe also had malaria and some other things that he was dealing with. So labor was quite challenging, having a high fever and really not feeling very well. And because of the challenges of having malaria, I had to get a C-section and be rushed into a hospital in Nigeria. And the hospital and the surgical room is very different from one in the US. One of the things that they would not allow was we had to make sure that we paid before our surgery, even though it was an emergency. And it was just overall not to the highest standard that you would hope for when you go to a hospital. And it wasn't the cleanest, and there wasn't ample resources just because of they don't have as much in Nigeria available. My experience giving birth to Noah, it was in the US. It was very different. The labor was still quite challenging, but being in a hospital in the US, there is plenty of resources. There's running water, there's consistent power, and we don't have to worry about having enough nurses to take care of you. There was just so many differences that we've seen that we really, really desire to see in hospitals in Nigeria. And we believe that the Lord is wanting that as well.
Yeah, we were really excited. Also, there was a lot of thoughts that came with it. You know, we were the first missionaries in Nigeria that were going to have a baby there in Nigeria. And so there's a lot we had to plow through, and, you know, had to make sure that we weren't allowing fear to come in and everything, giving birth in a third world country. A lot of family questioned that and whatever, but we definitely felt the Lord wanted us to give birth there. And we were really excited knowing that the Lord was going to carry us through it. And we were going to be blessed with our first child there in Nigeria. So we were just really excited for all of that. Esther was born in McCurdy, and the hospital was very much different than a hospital you would go to here in the US. A lot of things that you wouldn't expect to have to request, a lot of things that you would have to watch out for and be careful for. One of the things is something that Nigeria itself deals with, and a lot of electrical things aren't grounded or wired correctly. So, for instance, I would get shocked by the fridge in the room or the tea kettle, and it was just a difficult time. You know, the toilet didn't have a toilet seat on it. There's no running water, so you have to go and fetch the water. There's a lot of difficulties, you know, so it's not as comfortable, and even the power was out for a time, and we had a request for the hospital to turn on the generator and pay for the fuel for the generator. So a lot of things that you wouldn't normally think about or worry about here in the US that you definitely have to adapt and take on when you're at a hospital there.
In light of these challenges faced by many Nigerians, Ignition 633 Ministries is on a mission to bring hope and healing to our communities, especially to our neighbors, by establishing a well-equipped clinic where health issues can be adequately addressed and treated. Today, we have with us the Ignition 633 medical personnel who will share the vision and mission behind this project and what it means for the people we serve.
My name is Dr. Daniel Aga. I am the campus doctor here at Ignition 633 Ministries, Nigeria. We have a range of programs that we do, ranging from caring for residents, staff, the IDP camps, and recently we're working on our 633 International Medical Center. This is a a health center that is supposed to cater for the needs of staff of Ignition 633 and also the community around Benue State and even beyond the state. The vision is to provide essential health services that are not so common and available in our immediate setting, include and also be able to offer state-of-the-art care and exceptional medical care to people around because of the numerous challenges are in our environment. Presently, we have doctors of the state on strike. That's the resident doctors on strike. So you will see them healthcare in the facility, the Benue State University Teaching Hospital is not at the peak level. So with the coming of the 633 Medical Center, we will be able to cater for these excesses and these lapses that come from time to time. Doctors going on strike, many nurses going on strike, or sometimes if you want to do a CT scan, a PET scan, MRI, and other tests, and they're now available within the state or even close by at that point in time. So we are hoping that the coming of this and 633 Medical Center will bridge the gap between all these shortfalls that we experience from time to time. This is not just going to be caring about the physical needs of human beings. As a ministry, we want to look at taking care of people beyond the physical needs. We want to always appreciate the fact that man is made spirit, soul, and body. And we want to equip ourselves in such a way that we'll be proficient in caring for the whole man. That is, we're not just going to be treating the body, but we'll also restore souls and lives to Christ as we offer care, just like we've been doing in the IDP camps and elsewhere. So it is our prayer, our earnest desire that God Himself, who brought the idea of this project, will continue to see it through the end. They say, better is the end of a matter than the beginning thereof. So we're looking up to the end to come forward gloriously, and so that more glory will return to God. Thank you.
We thank God for the vision, resources, and the people He has provided to make this dream possible. We are grateful for His love that inspires every act of compassion in our community. Let's continue to pray for wisdom and provision to complete this clinic project, and for skilled and dedicated healthcare workers who will employ in the future to work in this aspect of our ministry, and for every patient who will walk through its doors to encounter not just healing for the body, but peace and hope for the soul. Thank you very much for watching this video, and we'll see you in the next one.